Thank you for having me. My name is Abebe Bekele. By training, I'm a professor of surgery. I'm a thoracic surgeon. At the University of Global Health Equity, I serve as the Deputy Vice Chancellor of Academic and Research Affairs and Dean of the School of Medicine. The short answer to your question is anyone is eligible to join UGHE. Our motto is young people with the heart, the brain, and the hands to be healthcare professionals should be given the opportunity to. What do we mean by that? The heart comes first. Compassionate, kind, caring health professionals. What do we mean by the brain? Young people with the knowledge and the skill that can be instrumental for them being healthcare professional. And the hands. Healthcare is not just about knowledge and attitude. It's about skills. They need to be able to do something with their hands. So our principle is that barriers to being healthcare providers, such as inability to pay, social status, where you are coming from, who you know, who you do not know, should not matter to come to UGHE. So anyone who fulfills the recruitment criteria, despite the being able or being unable to pay, is eligible to join UGHE. Thank you. I joined UGHE in May 2018. University was opened in 2015, so it was already in existence for 2.5 years before I joined. At UGHE, when I joined, the Executive Education Center was already established. We were doing executive education programs to trainees in Rwanda and beyond. And the Masters of Science in Global Health Delivery was already established. 3 cohorts of students were already enrolled. There was already 1 graduation, and I joined at the 2nd graduation. After I joined, the major activities taken were the university started taking the shape of an academic institution. We started putting in place the governance structure, the university legislation, the relevant posts that lead institutions, the different committees and subcommittees that lead academic and research affairs, and we started opening the several academic units. These include the School of Medicine in 2019, the Center for One Health in 2019, Center for Nursing and Midwifery, the Center for Gender Equity, the Center for Global Health, Global Surgery, our Educational Development and Quality Center, eventually our Institute of Global Health Equity Research. These were opened within the coming 3 years. Then we went ahead and established our Center for Population Health Science, our Innovations Unit, our Center for Transformative Learning Technologies, and other relevant academic programs. We started enrolling students to the MBBS MGHD program in the School of Medicine. We established a master's degree program in nursing leadership. We then established a master's program in health professions education. Just last week, we started our first residency program in general surgery, and we hope to start also a few residency programs next year. Our PhD in global health hopefully will be started in July this year. It's still under development. And we have quite a number of executive education programs going. Our flagship program, the MGHD, now has 5 options under it. These are the health management, the One Health, gender and sexual reproductive health, global surgery, and most recently, the community and social medicine option. All this happened after 2018. I joined UGHE. Yes. To be honest with you, COVID did not impact us a lot. We are one of the very few medical schools, universities in the world that were not forced to shut down. Education continued, research continued, our activities continued. Unfortunately, the entire world ceased to function. Many medical schools were shut down, universities were shut down. I guess because we are a new university with a resilient system, we converted everything to a virtual teaching within a very short period of time. We convinced ourselves, the faculty, the students, we need to stay united until COVID passes, endure all the difficulties caused by COVID, and survive. So it did not impact us a lot. None of our students lost a day of teaching. Life continued as normal. But in terms of our global partnerships, in terms of our speed of opening new academic programs, in terms of hiring faculty, it had an impact. But the silver lining of COVID has been, we tested ourselves. We proved to ourselves that we are resilient. We can convert from a fully in-person teaching to a fully virtual teaching in a very short period of time. And we survived it. Thank you. Well, Paul was the visionary behind the university. He was the chancellor, the founding chancellor of UGHE. He was a teacher, he was a researcher, he was an integral part of the institution. Unfortunately, he passed in February 2022. Imagine a family, a very close family, with really good relationship between the parents and the children, and suddenly the father dies or departs. That was the feeling the university had. Fortunately, Paul helped lay a very solid foundation. Even without him, finding our path and remaining on that path was doable. It was not easy, it was a very huge challenge, but it was doable. We survived his loss because everybody stood with us. The government of Rwanda, His Excellency and the First Lady, all our global and local partners, the founders of Partners in Health, the UGHE staff, faculty, and the students stayed together, readjusted ourselves, and remained on the path. So that local and international partnership and support we got, and the solid foundation Paul helped us establish was the reason we navigated through it. It was not easy. It was not easy. But thanks to what we did together, we survived it. Yes. The government of Rwanda, His Excellency, and the First Lady were integral parts of UGHE's formation. They were friends of UGHE since 2015, since it was just an idea. They are part of the family. When Paul passed, they became very close to us, supporting us in anything needed: advice, guidance, emotional support, policy support. They were there. The family came to the campus to be with us. The sector organizations, the Ministry of Education, the Ministry of Health was with us. They understood we were going through a difficult period. That is what I mean by that partnership. The fact that you have someone to talk to at the highest level, to seek for advice, for guidance from the highest level, is what is meant by partnership. The government of Rwanda played a huge role in the establishment of UGHE as a university since inception. That's the Thank you. It's in our policy. UGHE was established as a global university, as the name implies. Our influence is not just limited to Rwanda, but mainly to Africa. Our objective is train as many healthcare providers who can serve as change agents, leaders in health delivery. That is why we are recruiting actively from 9 African countries in the School of Medicine and from 30 countries in the master's program, and quite a lot of trainees from the executive education program, mainly to train very well trained, qualified people and help them influence change in their own countries. On the flip side, when you have diverse group of students in your country, in your university, there will be cultural competence among the students, cultural exchange, knowledge exchange, experience exchange. That lifelong partnership, friendship these young people will develop at an early age is critical for their growth. The learning is from the foundation of Partners in Health in the 1980s. PIH is established by 4 young friends. Their friendship persisted for 40 years and resulted in the creation of a huge NGO in this institution. That's what we're trying to copy, emulate. Such friendships among Africans at this institution, who knows, in 20 years can lead to something huge, something great. Those are the benefits. Learnings in the past 10 years has been, number one, you can't do this alone. You have to work with others. That is partnerships. Partnerships locally, countrywide in Rwanda, regionally among the neighboring countries, continentally, and globally. You can't do it alone. That's one of the learnings. The second is, it can be done. In Africa, in the most rural part of Rwanda, in Burera, such a quality education can be done. That is what we have learned. If Burera can do it, if UGHE can do it, it means Africa can. We have the potential to change. The third is, our future is bright. Africa's future is bright. The young boys and girls we are recruiting to the university have clearly shown us, if given the opportunity, they can change the country, they can change the continent. These, in my opinion, are the 3 learnings we have over the past 10 years. Next is, number 1 is, keep doing what we are doing. You can't fall back. We have proven that quality education can be delivered in Africa, in the most rural part of Africa, a new model of education, a new model of delivery. It has to continue. So step number 1 is make sure this continues without interruption. The second is, our impact should not be just local. It is regional and continental. Our footprint should be influencing the region and the continent, just like any other university. And third, universities do not survive in a vacuum. They are in place to serve the system they are in. So we need to align with the policies and guidelines of the Ministry of Health and the government of Rwanda. We are huge partners in the 4x4 initiative. We are huge partners in the Vice Chancellor. 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 We are huge partners in in almost all the initiatives the government has in place for the country. We will keep doing that. For ease, summarize what we will be doing in the future. One is expansion. Enroll as many students as possible from as many countries as possible. Second is equity. Provide access to education and research and health to the most disadvantaged people, to the poor. Third is excellence. Quality education, quality research. And the last is employability. Our graduates should be able to find jobs, to survive to bring about change. So new programs we are starting or we will be starting, we will make sure that these are important programs that will help our graduates be employed. This, I think, is the future of UGHE.